Hi, Dr. Lin here. Today I would like to talk about one of the hidden causes of low thyroid symptoms, even though your lab tests look normal and even though you may be taking medication, and that is cytokines and receptors. Elevated inflammatory cytokines blocking thyroid hormone receptor sites. Let's review for a second. You can take thyroid hormones, but that doesn't guarantee that you will get any benefits of the hormone. Why? The hormone has to dock on the receptor, and the receptor has to then respond to the docking. T3 comes along and docks on the receptor, and then the receptor makes the machine inside the cell do what it's programmed to do. This system depends on a receptor that is unblocked and responsive. Cytokines can block and make the thyroid hormone receptors unresponsive. This causes low thyroid symptoms. Cytokines are immune system messengers like interferon gamma, blah blah. We all have cytokines in our body, but people with inflammatory conditions, or autoimmune conditions have a lot of cytokines. For example, if you have common conditions like Hashimoto's, vitiligo, rheumatoid arthritis, PCOS, endometriosis, chances are you have a large amount of cytokines floating around. And that can affect your thyroid hormone receptors and cause low thyroid symptoms, even if you're taking medication like Synthroid, Armour, or Cytomel. What causes high levels of inflammatory cytokines? Well, there's a ton of reasons. Here's a partial list: food sensitivity, stress, infections that are viral, bacterial, autoimmune conditions, chemical sensitivities, hormone imbalance. It goes on. But cytokines can shut down the receptors for T3, making you feel hypothyroid and actually function as hypothyroid, even though your lab numbers are normal and within the lab range. So you might still have some of the low thyroid symptoms like hair loss, you gain weight no matter what you do, you get brain fog, you think slow, you got memory problems, you can't find words, you sleep excessively in order to feel better, you're constipated, your skin's dry, your hair's falling out, you got nail problems, infertility, miscarriages, high cholesterol. So high cytokines can make you have all of these low thyroid symptoms. This is a hidden cause, mainly because the lab numbers really are normal. This can confuse your well-meaning doctor. If your TSH and T4 are abnormal, the answer is easy: prescribe thyroid hormones. But if your labs are normal and you have low thyroid symptoms, what does your doctor do? Usually he or she says you're depressed and recommends an antidepressant. What if you're already diagnosed hypothyroid and taking thyroid medication, but you still have low thyroid symptoms? The thyroid medication can make your T4 levels look normal, but if you've got something that's suppressing the receptors, you will not get the benefit of all that T4 floating around in your blood. I hope that makes sense. You can have a ton of Synthroid circulating around, but it's all for nothing if cytokines are blocking your receptors. You will feel like you're not taking any medication at all. Typically, look, none of these other approaches have worked. All of these other mechanisms are not what's going on with you. Maybe it's inflammation, cytokines, and receptors. I see this scenario in about a lot of my patients. So, how do you deal with high cytokines and blocked receptors? You've got to find out what's causing the inflammation in the first place. For example, is Hashimoto's the cause of your high cytokines and blocked receptors? Hashimoto's is an inflammatory autoimmune condition featuring high levels of cytokines. You can have both these mechanisms happening at the same time. There's no rule that says you can only have one thing wrong with you. You could have Hashimoto's and the cytokine receptor problem. I see it all the time. Is it the fact that you've got some other autoimmune condition that we've talked about? Do you have a leaky gut or a GI dysbiosis, a gut infection that's causing inflammation throughout your entire body? Do you have a food sensitivity, a chemical sensitivity? You have got to find Now you have to find somebody that knows how to look for all of these factors and understand that cytokines can block receptors and know what to do correctly to address the cytokine problem. Your doctor is going to have to think outside of that normal box and consider that cytokines are shutting down the receptor, even though your lab tests may look normal, even though you might be taking thyroid medication already, but you can still have this problem. So find someone who is trained in functional medicine and will be able to help you diagnose this problem and what to do about it to make you feel better and get back on track. Thanks for listening.